This is Data Bytes, snackable insights to drive innovation in healthcare. In this edition, we'll be discussing digital transformation, the future of healthcare, and the tech tools that drive savings. Let's start off with some words from Arcadia's VP of Analytics and Chief Analytics Officer, Jake Hochberg. Jake recently spoke about how data and AI are transforming healthcare, and organizations must ensure they have the right resources for data utilization. Let's hear more from Jake about the power of analytics teams, data platforms, and data-driven decisions from our web series Unlocking Big Data, presented by HIMSS.
The organization I started my career at, there was very little data being used when I arrived. We were mostly working in Excel spreadsheets, and there was not really data being used in any formal business decision-making. So something that evolved over time was we built out an analytics team, we invested in a data platform, we started to prove the value of data and strong analytics. Once we did that, there became kind of a top-down initiative that we weren't going to start new programs, we weren't going to start new initiatives without data informing that. We got into a culture of people going to the analytics team for requests when they needed something new, and using real reporting to track outcomes after we started any program.
Now, let's check out a data point: how AI and ChatGPT are changing healthcare delivery. According to the National Bureau of Economic Research, wider adoption of AI could lead to savings of 5% to 10% in U.S. healthcare spending within the next 5 years, roughly $200 billion to $360 billion annually in 2019 dollars. To read more about this topic, see the link to our article on AI adoption in the description of this video. Let's turn it over to a customer story: how Southwestern Health Resources uses quality data to transform care delivery.
Prime dashboard was more of recreating this platform which would truly harness the insights from the various domains that make up our incentive model, so that our organization can deliver operational excellence, and that we can drive innovation, and that we can support the growth of our organization.
Let's now take a closer look at Arcadia Vista's growing library of healthcare intelligence dashboards. Vista is Arcadia's web-based business intelligence tool that delivers insights to your quality analyst teams in order to glean a bird's-eye view of your organization's quality performance and identify quality improvement opportunities. Once your organization's data is ingested, normalized, and validated, Vista provides out-of-the-box dashboards that are built on real use cases from leaders in value-based care and healthcare delivery. The Quality Performance Dashboard allows your analysts to view quality performance across your organization against 4 levels of measure targets that can be configured based on your contracts. During implementation, your teams will configure initiatives or quality measures grouped together for meaningful analysis. Filters are available to further slice and dice across various levels of your organization, like payer all the way to the provider level. On the Provider Performance tab, you can identify your top and bottom performing providers and identify quality measures of concern to target specialized coaching. On the PCP Performance and Groupers tab, this allows your teams to view quality measure performance across PCP practices. This is especially helpful to zero in on measures that are very close to the target and allow you to identify those lower performing practices that can really move the needle on your organization's overall performance. This is just one of the many Vista dashboards that are available out of the box across quality, as well as other domains of value-based care, like cost utilization and risk. Furthermore, our Customer Insights team is releasing new content quarterly. Next up is a clip from Episode 7 of Season 2 of The Schema, a web series by Arcadia that brings together the healthcare industry's best minds, innovations, and insights. In this clip, Arcadia's Chief Product Officer, Nick Stepro, and Fortune 2 executive, public and private company board director, digital transformation thought leader, operator, and investor Phoebe Yang share how emerging technologies, AI, and the inevitable change caused by digital transformation can clear new pathways to how we care for patients. Let's listen in.
There are thousands of digital solutions out there to impact healthcare, and many of them are very, very strong. But unless you start with what I've seen as a common key ingredient across successful organizations adopting these solutions, you're not going to be successful. And that common key ingredient is culture change, a culture of wanting to innovate and adapt and advance and move forward. And a lot of organizations know the talking points around that and certainly understand that conceptually, but unless from the very top of the leadership on down, that culture change is ingrained into everything that we do, the change doesn't happen.
And that wraps up this edition of Data Bytes. Check out the description of this video to see further reading and resources. You can also sign up for Data Bytes to receive this content in newsletter form straight to your inbox. To see more of how you can harness the power of data and analytics to drive healthcare innovation, request a demo of Arcadia's powerful data platform. Thanks for tuning in, and we'll see you in the next video.